Prof, give us a breakdown about how the program of the 7th SATB conference looks like, and of course what you think makes this one a significant event.
Yeah, this one will be very important because for the last 3 years, as you can imagine, we haven't met in person, and we've had a COVID epidemic that has really affected the TB control in this country. So globally, in the entire world, for the first time in many years, we've seen an increase in the number of people that have died from tuberculosis over the last 2 years due to the COVID epidemic that prevented optimal care for TB. And some of this may have happened in South Africa too, so it's really important that we now get together and talk about what we can do after we've had some setbacks due to COVID. So the theme of the conference is working together to get TB control back on track. And we've got various lines, various aims that actually all build towards getting that achieved.
Now, when you talk about these setbacks, just break down to us, some of the most notable things that resulted in the setbacks from COVID-19.
Yeah, so I think it's actually quite simple that because of the health services that had to focus on COVID-19 and because people were not as mobile during the epidemic and didn't come to seek care for potential tuberculosis, the number of people that we found with tuberculosis in South Africa dropped quite dramatically over the last 2 years. So the number of tests that we do to diagnose TB has dropped very significantly over the last 2 years. And so we feel that we've actually missed a whole lot of cases. We haven't identified a whole lot of people with tuberculosis that could be out there in the community. And while you have active tuberculosis, you can, of course, spread it to other people around you. So we need to actually take stock of exactly what has happened, and that's really what the conference wants to do. And then from there, look at what the responses should be. There are already some responses from the government, very good responses, but I think the whole group of academics and government and other people will get together to see if we can do even more to get TB control back on track.
Now, what opportunities, Prof, does the theme working together to get TB control back on track provide for the community that works on TB and, of course, faces these setbacks?
Okay, so we will not only focus on the COVID-related issues that I just mentioned, but we will really also focus on re-energizing the TB community and through in-person interaction of academic, governmental, non-governmental, civil society stakeholders. And then we will also provide at the conference latest updates on things such as how to prevent TB, how to diagnose it, how to treat it. But there's a lot of new drugs and other interventions that have recently become available, new ways in which we treat childhood TB, for example. And then it will also have a focus on optimal community engagement and communications in TB control and research. We're looking more at the social aspects that are absolutely critical for control of tuberculosis. We cannot only look at the medical aspects. And then we'll also have a focus on what we call basic sciences. So those are the sciences that happen in the laboratories that ultimately discover new vaccines or drugs and diagnostics. So we've got quite a comprehensive program. But overall, I think the most important part of the program would be to look at how can we get back on track after we've had some setbacks due to COVID.
Are there any advances worth noting, Prof, that the country has made when it does come to TB prevention, diagnosis, and even treatment in recent years?
Yeah, I think we've got researchers across the board, from the labs that do this very basic science of research to right through clinical research, to social science research, to health systems and implementation research, that are absolute world leaders in tuberculosis. South Africa has always been a world leader in tuberculosis. So there could be examples in each of these domains in which we've contributed to. Perhaps the most exciting thing that is going to happen pretty soon is that we will be starting testing of a new tuberculosis vaccine. So you know that we've got a vaccine called BCG that all babies get. That vaccine should be given because it works very well in preventing TB, especially severe TB in babies. But the vaccine doesn't work that well in preventing TB in adolescents and adults, who are the people that spread the TB. So this new vaccine has shown in preliminary studies to be about 30% effective in preventing TB. So we need to expand that to much greater numbers ultimately to make sure that it's actually true. So that's very exciting that this study will ultimately be done in South Africa over the next 2 or 3 years to see whether we've got a new way of preventing TB in South Africa.
Fantastic. Prof, just to conclude our conversation, where and how do people go about booking their place for the conference? And also, if there are costs involved, you can just talk us through that as well.
Yeah, so the best way to access this is to go to tbconference.co.za, so that's tbconference.co.za, or just search South African TB Conference 2022. I think there is a registration fee of 5,000 per participant or 1,000 per day if you want to attend. So all the registration and other details on that website.